Good morning, everyone. I'm Riley King, and welcome to this morning news report right here on the Riley King Network. Let's begin. Following CDC and FDA recommendations, New Hampshire pauses distribution of Johnson & Johnson COVID-19 vaccine. State moves Pfizer, Moderna doses to cover those scheduled to receive Johnson & Johnson. Granite staters who were scheduled to receive the Johnson & Johnson vaccine will now get another brand after New Hampshire paused administering the vaccine based on federal recommendations. The move was made after the Centers for Disease Control and Prevention and the Food and Drug Administration recommended pausing Johnson & Johnson vaccines while the agencies investigated a small number of cases of serious rare blood clots. Governor Chris Sununu said alternate doses from Pfizer and Moderna have been provided, so no appointments have to be rescheduled. And we're very nimble, Sununu said. We have a great connection with our doctors and pharmacies, the ones that were using Johnson & Johnson, so we just called them directly. States were notified by the CDC early Monday morning about concerns over Johnson & Johnson's vaccine. Officials said 6 cases of blood clot issues out of the close to 7 million doses delivered was enough for federal agencies to want to take a closer look. This shows that our system picked up very few rare side effects, said infectious disease specialist Dr. Elizabeth Talbert. What is happening is exactly what should happen. Sununu said Johnson & Johnson is most sought out vaccine in New Hampshire for the convenience of being one and done. The governor was among the 12,000 who received it over the weekend at New Hampshire Motor Speedway. We think this is going to be a temporary pause, and we're happy to do so, he said. We got a lot of Johnson & Johnson out this weekend very successfully, and we are all hoping that it comes back online in the next few days. Once the pause is over, if someone doesn't want Johnson & Johnson, will they be able to request a different brand? If we have to take that track, we can, but right now we don't really see a need to, Sununu said. Right now we are awaiting for the FDA and CDC to come back to us. The risk of having COVID-19 itself and having bad outcome from that far exceeds the risk of having a bad outcome from the vaccination, Talbert said. Health officials said none of the blood clot cases that are being investigated are connected to New Hampshire residents. Some Granite staters who have received the Johnson & Johnson vaccine said they're now concerned. I had just gotten it and I was like, okay, it's about 48 hours and I feel good. one resident said who received the vaccine Sunday. And then I hear it's being paused due to concern. I was like, oh my god, what are the concerns? The sixth woman who developed blood clots experienced symptoms to 6 to 13 days after vaccination. The pause on the vaccine gives time to inform the healthcare community about the events and how to treat them. The other unusual features of this syndrome is that it should not be treated with the most common drug for clots. That is, Talbert said. Clinicals know, and we are communicating with them regularly. That treatment includes other kinds of congregations. Those getting the Johnson & Johnson vaccine should watch for symptoms within 3 weeks after vaccination. That includes severe headache, abdominal pain, leg pain, or shortness of breath. Doctors in New Hampshire said they don't expect to see any cases in the state. The number are exponentially low, said Dr. Martha, Infectious Prevention Director at Wentworth Douglas Hospital. In fact, I don't even know if there's any science that would indicate that it's any different from the general population that has not received the vaccine. Officials said the investigation could be complete in a matter of days. And that does it for this morning news report right here on the Riley King Network. Thank you for watching this news report and have a wonderful day, everyone. See you tomorrow for another news report. Goodbye.